Hello, everyone. Welcome. My name is Patrina Pellet. I'm the creator of Medical Affairs Value. I've partnered up with Tracy Wilson, who is an expert on health equity. We have partnered up together to think of different ways that we can help medical affairs gather better health equity insights. Tracy does a lot of work out in the field and has these conversations frequently with HCPs. And I'm really excited to get to share some of her expertise with you all today. Tracy, what are some of the big challenges you see when you're out there conversing with HCPs?
Thanks, Katrina. I think for me, one of the big challenges is just having healthcare providers just be comfortable in the conversation and wanting to share. A lot of healthcare providers are, working in diverse communities and having them just be comfortable and wanting to share with, their experiences, I think is probably one of the very first challenges that I run into.
Yeah, and then also probably the challenges from the MSL's perspective in having the being comfortable in having those conversations.
Absolutely. I would say probably it's the two part, right? It's that, the healthcare providers comfort level, and then also, the MSL's comfort level. Or do they even know the right language? Do they even know the right questions to ask from their own purview? And so just, both individuals being comfortable in their own skin, knowing what is the right things, to say, what is the right things to exchange as far as the information around health equity. What is health equity? What does it mean to you? What is equity? What is equality? That information. Those are probably the first thing is everyone getting over the barrier around those conversations from their own perspective.
Yeah, absolutely. And I had a big insight when I was working with you, Tracy, on this. I wanted to ask a question, but I was a little bit scared or uncomfortable about asking it. And so this was really eye-opening for me about the need to have our own awareness and the need that other people have in terms of getting comfortable about talking about these uncomfortable topics.
Absolutely. I would say probably, again, when we're talking about these conversations around equity, it's starting off that very basic conversation around, bias, implicit bias that we all have it. We all have those because that comes from our upbringing. It comes from where we come from. So it's owning what our biases are. And then once you overcome those particular issues and what those are, then we can kind of start to unpack the layers around then, our own particular, main issues, and then start to have those more in-depth conversations around, mean health equity and how we can help patients then figure out what their needs are. Because that's exactly what I think the common goal is from, the medical affairs objective, and then from the healthcare providers objective is the patient outcomes.
Yeah, absolutely. I love what you said there. It's like peeling back the layers of the onion and just getting comfortable with the uncomfortable. And oh, you need to check out our article that Tracy and I wrote together. We put together common definitions around health equity issues that will help you have these deep conversations. And we believe that there's nobody better positioned than medical affairs to really make a difference in this space.
Absolutely. I think everyone can gain a little bit more, insights in this area, and then be able to take those insights back to the organization to be able to make a difference. Mean from the top down and in the middle. So absolutely.
Yeah, and in the article, we include areas that you could look for or to focus on your insight gathering to really help these underserved patient populations. Well, Tracy, thank you so much for partnering with me on this. It was super fun, and I really think everybody is going to benefit from this content that we produced.
No, thank you. I appreciate the partnership.
Yeah. Bye, everybody.
Bye.